A lot of people are already joined, and I would say let's start this webinar. And so welcome to our webinar on CFRM Essentials for Local NGOs. If you are joining right now, please share your name and your organization in the chat. And if you want to, please say hello in your native language. My name is Eni Kövas. I'm the Content and Communication Manager for Terre des Hommes Partnership and Localization Project, Local Link Hub, and I will be your host today. Just a moment. See, you have the QR code here if you want to visit our website. So Local Link Hub is actually an online resource platform. We are available in 9 languages: Albanian, Arabic, Bengali, French, Hungarian, Hindi, Nepali, Ukrainian, and English. At Local Link Hub, we support our local partners and local national NGOs as well, where you can grow, communicate, and connect. So how local organizations can grow by taking the curated e-learnings we develop and provide for free. This is the CFRM e-learning as well. We have a lot of different topics covered: fundraising, environmental sustainability, CFRM, communication. We will provide you to the link to these e-learnings. At our site, we also publish news about local organizations. So if you are a local organization, partner organization of TDH, please share your milestone with us. We are more than happy to help you publicize those. We also publish curated grants every Friday. The link also will be provided in the chat. How you can connect: you can follow us on social media, you can subscribe to the newsletter, or you can register to our site as partners to have access to the e-learning. Okay, here you have the direct access to our e-learning, but I will share this in the chat as well. And here you have the direct link to our grants, but you don't need to go there right now. I will share this in the chat as well. Some housekeeping announcements before we start the webinar. The language of the webinar is English. The event is recorded and will be made available along with the presentation slides. The chat window is open. Please write down your comments and please put there your name, as I already mentioned, your organization you are from, and if you want to say hello in your native language, please do so. If you have any questions directed to our panelists, please put them in the Q&A section. Depending on the time left in the session, we will try to answer these as well. Unfortunately, if we won't have time for every question, we will send you the answers after the webinar along with the recording of the event. Yes. Okay, the automated live captioning in English is available. You can turn it on using Zoom's functionality. At the end of the event, we will have a short survey about the webinar. Please take the moment to fill it out. It's very short and will help us create better webinars. So let's go on to the point in discussion of today. Today's webinar is Complaints and Feedback Response Mechanism Essentials for Local NGOs. This webinar is based on our free e-learning course available on Local Link Hub, which has 2 modules, one for beginners and one for CFRM professionals. It takes around 80 minutes to complete, and at the end of the course, we offer you a certificate of completion. Let me present you our speakers today. They are Sophie Maréchal and Sukanta Paul. Sophie is the male global advisor at Terre des Hommes, and she has over 18 years of experience helping international organizations improve their programs through monitoring and evaluation. She works to develop tools and trainings to measure program success and ensure quality. In past, she gained experience at UNICEF, UN Women, and Oxfam in countries like Peru and Palestine, focusing on child protection, gender equality, and justice programs. The second panelist is Sukanta Paul, the regional quality and accountability advisor at Terre des Hommes. He has 15 years of experience in monitoring, evaluation, research, and development. He holds a master's in public health and a background in anthropology. He specializes in designing quality and accountability systems that strengthen child labor or child protection, health and WASH, migration, climate change, and social cohesion programs. Sukanta supports TDH delegations in Bangladesh, India, Myanmar, and Nepal. Let me adjust a bit my presentation here because it seems like I cannot move it. A moment, yes. Now I can move it, yes. Thank you for letting me know. And now I give the floor to Sophie. So Sophie, please, it's your turn.
Yes, thank you very much, Eniko, for this introduction and for this space, actually, to discuss about this important topic. And I'm so glad to see this richness of the group of participants, people coming from everywhere, the Middle East, Africa, Asia, Europe. So it's fantastic to see you there to discuss this topic and see TDH colleagues and also partners organization being present. So thank you for joining this webinar. So today we are going to discuss about what is CFRM and why it is important, actually, what role they serve, why it does matter, how it links with accountability, and then what are categories of feedback and complaints. What is it is important to distinguish categories and how we respond to those categories. Sukanta will tell us about that. And then we will discuss about the process to set up CFRM and then the process of dealing with feedback to closing the loop and what are the main principles we have to follow to make them work effectively and safely. So it's a basic webinar, but we also will have the opportunity to share with you some experience we've built working on establishing CFRM that are child-friendly. So I hope it's going to be a very interesting session, and it's going to be interactive. So please do not hesitate, ask your question. We'll do our best to answer them. First is we wanted to discuss what is a CFRM and why it is important, and just a quick connection with the core humanitarian standards that you certainly all know, the CHS, that is the globally recognized standards that we humanitarian actors, we use to improve our quality and effectiveness. And the CHS is very important here because it places communities and people affected by crisis at the center of humanitarian action. And the CHS sets out 9 commitments that you see here on the screen that help us understanding how to support people and communities in ways that respect their rights, their dignity, and promote their primary role in finding solutions to the crisis they face. One of those commitments is especially dedicated to complaint and feedback response mechanism. It is the commitment 5. It says that people affected by crisis can safely report concerns and complaints. Then we have also commitment 7 that mentions that people affected by crisis can access support adapted based on their feedback. So it emphasizes the importance of learning from the feedback we receive and improvement of the intervention on this base. And commitment 1 is also very important because it sets the tone. It says that people we work with and for should be provided with spaces and opportunities to exercise their rights and participate in a decision that concern them. So we will see a bit more in depth how other commitments are also related in next slides. So the complaint and response feedback mechanism cannot work without, if you can go to next slide, Sukanta. It cannot work without participatory approaches established since the start of a project. And it is very important to connect CFRM with a community-based approach. So we must build on what is working on the basis of community preferences, ideas, and strengths. And commitment 1 has like sub requirements. Sub requirements to say that we have to share relevant and timely information, including about the rights of people in relation to our commitments and our responsibilities. And then we must ensure that the participation of people in decisions and actions is meaningful for them. And very importantly, it corresponds to their preferred way of engaging. Then commitment 2 says that in its requirements says that programs must respect and build upon local knowledge, capacities, and existing action. And then the third one that is about resilience says that we must support formal and informal community leadership and locally led efforts to reinforce the resilience of people and communities. So this is very important to start from the CHS and see how the CHS tells us how to work on community engagement. And a CFRM that is not established in this spirit will not work. And even if we have started engaging with community since the start, we must keep on preventing throughout the intervention. We must continually work to prevent and address any risks that would materialize, learn about evolving contexts and realities, improve the intervention continuously. Because we might not have identified all needs, for example, especially if they evolve quickly. Then some people, intervention, children might feel excluded because of different reasons, capacity, language, gender, age, or other reasons. Then there might be operational problems arising or coordination problems during the intervention. There might be also issues or tensions in the community, unexpected, upcoming, or eventually also due to our intervention, maybe because information was not clear or there was an operational issue. And finally, and despite all the awareness raising, the training, the code of conduct in place, we might see that at a certain point, staff, volunteers, provider might not behave according to those standards. So when an intervention is running, we really need to give ourselves the capacity to identify those issues and react. There might be also other situations where people would like to inform us about something, alert us or share their worries, discomfort, fear, dissatisfaction. So we need to provide them modalities to do that. And just to those cards that you've just seen, they are produced with our teams in the countries where TDH operates in Africa. And they were based on what children told us that they might fear to see in an intervention. And so for us, complaint and feedback response mechanism is one pillar of our accountability framework. And accountability means that we must use our power responsibly. We must also be held accountable for our actions. And this requires to be very transparent about who we are, our mandate, our standards, our methods, how we should behave, our code of conduct, and our project activities. We also must apply diversity and inclusion principles and promote participation and engagement of communities, and put in place mechanisms to receive, address feedback and complaints from all stakeholders. It's one of the pillars, but it cannot work alone. And this is how looks like complaints and feedback mechanism, a response mechanism, how we wanted to summarize what it is actually. You see that it starts with finding how to communicate ideally with the communities in a transparent way, in a timely way, in a safe way, and in a bi-directional way. So it's not just us towards the community or the communities towards us. It's a cycle, no? And the first step is to understand how to communicate with the different groups we work with. So it articulates different modalities together, communication modalities that would enable us to receive and listen concerns, feedback, information, and then organize this information to make sure that we can actually solve an issue and respond and learn and improve. Suganta will explain later on what is the triage, why it is important, what are the different categories of feedback, why it is important also to distinguish between operational, so-called non-sensitive feedback and sensitive feedback. But this is really in a nutshell to show you how what purpose it serves actually. And just to clarify on the definition aspect, so a mechanism, it's a big word to say that actually it's a set of standardized procedures, tools, communication modalities that allow to do different things, to show for people to share their experience, their question, feedback, complaints. It allows us to acknowledge, recept, and analyze what's happening, propose a solution, and inform and find a solution, implement it, and inform on the response, and make sure that the person is satisfied. So it's a combination of many things that has to be articulated and balanced according to our project, the nature of our project, the type of activities, the public we work with, and the constraints we have. And just to distinguish feedback and complaint, feedback is a positive or negative statement, an opinion, a question, a statement about our intervention or the staff behavior. And complaint is a grievance against the organization for not fulfillment of a commitment. So it means that people must know what are our commitments if we want them to be able to raise a complaint. And an important point here is that we must be ready to receive positive and negative feedback from people, and must be ready to address them. And that's not necessarily easy, but we need to deploy all our the possible modalities to make sure that we can receive even negative feedback, knowing that people often they don't dare. They're very polite. They respect humanitarians, and in many communities, it doesn't feel very respectful to raise a negative feedback. So we really need to work in advance with the communities to make sure that they feel legitimate, and they will dare raising even critical, not so positive feedback. So why does it matter? And we had a question in the poll on this, but I'm sure that you've experienced that already, that if we manage to establish efficient complaint feedback response mechanisms in combination with the other pillars linked with accountability, it enables us to really build trust or strengthen the trust with the communities, empower the groups we work with and for, learn and improve continuously and prevent harm to be happening, or if negative effects and harm is happening as part of a project, to readjust quickly and repair eventually the harm that would have been caused. So this is about what is a CFRM in a nutshell and why it is important. Now Sukanta will explain us what are the different categories of feedback and complaints at TDH. Thank you. Sukanta.
Well, thank you, Sophie. Yeah. So as explained by Sophie, I will explain now the categories of CFRM in TDH, but in other NGOs, NGOs, you might have the different categories. However, there are really coherence in those categories. As you can see, there are in total 6 categories in TDH, and we deal all the complaints and feedback as per these categories. As you can see, the first 4 are the operational and in TDH, I consider them as the non-sensitive categories, and 5 and 6 are considered as the sensitive categories. So the 1 to 4 is about the transmission of like information and warning, and where the community people, will have some request for some information on activities, or maybe they have some request for some assistance, or maybe they want to share some some issues around quality, etc. Yes, so for 5 and 6, as I have said, are sensitive ones, and so it indicates of the violation of the global code of conduct and the policies that we have in TDH. And 6 is also sensitive, but it's not related to our NGO, as in the space, a lot of other NGOs are like also working. Yeah. So the response of the complaints and feedback actually depends on the case and under which category the case falls under. Yeah. I'm going to the next slide. So, and this is why, triage is really important, because, at first, like, what is a triage? So it's a process of getting the cases, and also a kind of, analyzing the case and see under which category they fall under. Yeah. So it's a process of reading, analyzing the case, and also dealing the case according to the category and action plan, right? So, it also aligns, with the funnel principle, as we don't know, like what will come in the funnel, but after we read it, after we analyze it, after that, we label them under categories so that it's really easier to take action, right? And for this, it's really important to read and analyze and read and analyze. So it's an ongoing process, because often you see the case is really simple, but it's not, because it has some elements that really make it messy, and often you see that you will struggle to select the categories because of that messiness, right? So it's really important to read it, like again and again. Triage really helps us to categorize under which category the case falls under, and the person like who deal with the CFRM process, would have to be would have some understanding about the systems and policies and values of the organization. Yeah. And this is really helpful because it helps to limit the triage errors. So triaging is really important because it helps us to take timely action, because it is helpful to define the urgency of the case. You know, like how I mean like in how many days we have to take action for that. So so it really helps to I would say the timely action, and it also makes us efficient because I mean we know as per the category like what action. Well, I mean as per category, you know, like I mean who is really responsible for the action, and what actions can be taken. And as we have some category, it really helps to make a transparent system and a fair system, and also treat like every complaint and feedback with a similar weight. And as Sophie said earlier, that it's really helpful to make trust with the community people and the stakeholders with CFRM. And also so it really makes us more say uh, kind of like accountable, right? And it also helps us to learn, yeah, because all those feedback, all those complaints, and like all those concerns are really helpful for us to adapt our activities, our approach, so that we can do better. So here, as I have already explained, that we have the 6 categories, and now we have the 7 cases here. And as I'll read the cases, then maybe, you know, like 1 or 2 of you or 3 of you can answer in the chat that under which category the case fall under, right? Say the mother is asking for her adolescent to be registered in the vocational training program run by the the organization. What do you think that under which category it falls under? As I can see the chat, maybe like Sophie can see the chat and see, you know.
People are saying 3. It seems quite clear. 3
Okay,
category
let's see.
3 request for assistance. Yes.
Yes,
well
you're
done.
right. So the next case is a child is saying that the PSS activities are boring and they cannot suggest any activities that they would like. Under which category it falls?
4. It's clear also. It's very
All
fast.
right.
Yeah.
This is great.
Yeah, many people are.
So another case is someone reports that there was a request for financial and other favors to be registered in the list of beneficiaries. For this, which category it falls? I can see some responses in the chat.
There is a consensus about 5. Yeah.
5?
Yes.
I think you're right. Yes, as it says financial fraud, I'm not something in here, right? So it's wrong. So maybe one more, and then we go to the next slide. Yeah. So case 6. One father protests because the groups are not gender segregated and removes his daughter from activities. Under which category it falls? What do you think?
It's 4. Someone said 6. But there is a consensus on 4. Yeah, 4 is winning the.
Yeah, so it's 4 because the father is really, want that the groups are really segregated, are really separate on gender, and it's is maybe really important for the cultural aspects, right? So it's asking us to change our approach of working in there. So the last one, it says that a teacher, the report, means suspicion of child neglect in a family of his or her student. So where does it fall?
Yeah,
Yeah.
the participant that says 6, some of them are saying 3, 1, 6, 5. So this is a bit more complex. And yes,
yeah,
indeed, there is
yeah.
debate around this one.
Exactly. So we think that as neglect is a child protection concern, so we believe that, and we think that, it falls under 1 because it was a warning, as it says suspicion. Yeah, so it's like suspicion. So this is something that that really, like he or she highlighted here, but not, so it can be true or maybe wrong, right? So it's
May I add something, Sukanta, on this? Because there has been a debate in the organization on how to classify child protection or violence in the community. And in the beginning, actually, we had categorized it as a 6 categories, so sensitive, not related to organization. But actually, as we're in child protection organization, we prefer to categorize child protection issues in the community as category 1. The thing is that it's a sensitive situation. It's a grave situation. This is why we tend to immediately think in category 6. The fact that we labeled operational, non-sensitive 1, 2, 3, and 4 doesn't mean that they are not serious case. There may be serious issues that are reported. It's just a matter of labeling, actually, to distinguish cases that are alleged violation of the Global Code of Conduct versus the others, because they will follow a different case management process. So this is why, actually, presentation cases of child protection are not categorized under sensitive groups of types of cases. Thank you.
So let's go to the next slide, and it's about 7 steps CFRM process. So until you receive the case, until you close it. So at first, at first the focal of CFRM receive the case, acknowledge it, right, and then the person actually record it in one form or logbook, and then also the and also he or she analyze it and also triage it and see under what category it falls, and he or she also need to validate it also, like with others, to see whether it actually falls under under that category, because as I've said, that like it's often messy to decide under what category it falls, right? And the next is the referencing, to send the case to the appropriate person, like who would take the action, and next, after the action phase, the action is that you might need to take some appropriate case by case action. For instance, for serious cases, you might need to take some case management approach, or maybe adapt your actions, or give some message or information, etc. And after that, you also to validate the action that you take with someone in your team, and at last, you have to get back to the person who have given the complaint to make sure and also to inform the person that the action that that you have taken and whether he or she is really happy with the action. So it's like a ongoing process that follows. So here, like how to respond. So in TDH we have the categories. So you know the action loop, yeah, the steps, and now so then so you know that your cases under this category 1 to 6, yeah. So then what can be the action? So usually we have this 5 kind of actions. For instance, the first is actually to inform and explain. So and second is referred to service, and the 3 is assistance or to assist and protect, and 4 is to adapt. It means to adapt our activities as per the feedback, and 5 is to refer for investigation. Yeah, so this the 5 response categories that we have, and now we have the same cases that you read earlier, for instance. So and we will see so maybe say for one and one or two maybe to see under what action you think are really appropriate for the case. So let's see for the case study 1. So your mother is asking for her adolescent to be registered in the vocational training program run by the organization. So what do you think under or like which action you think is really appropriate here? Any response? From 1 to 5.
So I see 3, 3, 1 and 2. No, 2. A lot of 2. 1. 1 and 2. It's good that to combine response sometimes. Yes. 1 and 2. Yeah.
Okay.
1 and
yeah.
2.
So it's 2. So it's actually assist and refer. So let's take one more case, and we can go to the next slide. So a child is saying that the PSS activities are boring. So what do you think? What can be the action here? What can be the response here? Any
4. 4 it's
yeah.
4 is
yes,
the winner.
Adapt. So let's go to the next slide then, as we have less time in hand. So the key, in CFRM, you follow some, some key really principles. Then they are not rules, right? There are principles as because they are like flexible and also can be adapted, right? So the first is it has to be accessible by everybody in the community, right? All the stakeholders like children, adults, and person with disabilities. Like I also have to access it. It has to be confidential, yeah, and as often there are some sensitive cases, so it's really it's really useful to maintain privacy. And the other is safety and security. So to make sure that the person who is giving the complaint are safe, right? And also, we have to be transparent in terms of taking the actions as well. And we also have we also have 2 more criteria and TDH. What is called is zero tolerance. That that we don't tolerate any kind of unethical or unfair activities in our workplace as well. And we always follow the survivor-centered approaches, right? So these are the principles, and now I'll hand over to Sophie again.
Yes, thank you, Sukanta. So this is the how to set up a CFRM, and I just want to say that we received a very good questions, or a set of questions from Minaz, Breaking the Silence in Bangladesh, and we may address this question now. Because setting up a CFRM is not just putting like complaint box or feedback box somewhere. It requires really preparation and analysis of the situation prior to know how to proceed. So there are different steps prior to run the CFRM, and we should start by defining the objective and the scopes. It means to identify who would be in charge. A group of staff should be set up to work on the matter, and usually it's going to be someone working on monitoring and evaluation, accountability learning, or safeguarding focal points. It will depend. But this team should consider some previous question before establishing the CFRM. And the question by Minaz was, how can we ensure communities see CFRM as a tool for empowerment, not surveillance of risk of retaliation? So this preparation step is very important. You may want to run an analysis of what's running at the moment, what CFRM are in place or were in place, and how they were used. So were there any negative experience eventually? So we raised expectation, or an organization raised expectation, and we could not actually answer to the issues that were reported. So it created disenchantment, for example. So what happened before? And will the CFRM cover one project of all the projects in the organization? What type of feedback must the mechanism aim to receive? Who should be able to access it? What are the key persons and groups we should consult around this question to know how to set up the best mechanism possible? Are there any other organization active in the locality? And we should actually discuss with them, see if we must establish joint accountability mechanism, joint CFRM actually. So there are many questions to be considered because a very important point is that we face a lot of constraints, and if we have limited resources, we should not aim at like building a super sophisticated, all digitalized and tool that we would not be able to sustain. So again, this question of finding the right balance. So the second step is to identify the event modalities. So for that, we should not decide by ourselves. Of course, we should talk to the future users, the people we are going to work with, looking at what would be the preferred modality, what are the capacities, limits in terms of access to technology, for example, some literacy level, digital literacy can be also. We have also to consider the logistical constraints, the access or security issues. So this step involves consultation with all stakeholders and a special focus on children or groups of people who usually are less easily accessing communication modalities. Then ensuring staff capacity, and that is another question raised by Minaz. So it is important to have a group of people well trained on this, and the question was about what are the more crucial aspects to integrate in a training. And I would say that those persons engaged in the CFRM, they need to understand very well all of course, procedures related to CFRM itself, the CHS, all what it entails to be accountable. So, and then another key aspect is understand the communities. So understand how community works, what are the social dynamics, cultural aspects also, because communication is a lot about culture, and then communication mechanism. Then you have also, of course, how you manage a case. It's not going to be managing sensitive case because, as it was said by Sukanta, when a case is sensitive, a specific unit is dealing with this case, but we need to manage very well how you will manage even a simpler case that is like about dissatisfaction with the quality of an intervention, as okay, I receive an information about a child protection case. What should I do? And then this person will have to be very well organized, make sure that he or she follows up on the case and make sure it's not left without an adequate response. But interaction, communication with people it's a key area of training. Then sharing information and raising awareness. This is another element to respond to the question raised by Minhaz. Actually, CFRM is a tool to raise trust, is one of the mechanisms we can use to raise trust. But for that to work, we need to be clear about, okay, this is the mechanism that will be in place. We chose those modalities because of this reason, following consultation with communities. And this is the kind of feedback you can raise to us. And this is how we will do our best to address them. And they need also to know very well your mandate, how you should behave, as we mentioned earlier. So this awareness raising phase, it's super important to make sure that people will know how to use the mechanism, and also to make sure that you can manage expectations. Then the last step is maintaining it, process and response to feedback and complaints. And there is an arrow going back to the top, because you will see quickly if a modality or a channel works or not. For example, if you set up a whole online form and you receive no feedback, it means that it doesn't fit, doesn't match the user's preferences. So you need to analyze the data that you will collect through the CFRM, and data collection and management is quite an important aspect of this. And the presentation disappeared. So you will learn a lot if you process this data. You will learn a lot about whether your mechanism is working, for whom, and what modality works less than others, and then readjust also the mechanism. Thank you, Sukanta. So about the channels and modalities, it is key. We usually distinguish between two big kind of communication modalities. One of these categories is reactive. So we put in place modalities, and we are ready for people to get to us and share their feedback. And usually, typically, the feedback box is one of them, having a feedback desk on someone posted somewhere during a distribution or an intervention, and then people can come to this person and explain if there was an issue. Then you have the hotlines where you can receive calls and SMS, and a feedback form. We have also the proactive types of modalities. It means that we are going to actively reach people to collect their feedback. And this is very important to combine both, actually, to contribute to raise trust in the community. So it is the community meetings, group discussions, surveys, field visits with one-to-one discussions, after action reviews, workshop. And any most of M&E work is actually contributes to this. So key message: it is important to it's going to combine the channels, having at least one reactive and proactive together, so not relying only to reactive. On reactive modalities, then at least have one that allows for confidential feedback. And then think about, again, capacity, literacy of people. We often tend to rely on digital tools, but they might not be accessible for all. And in the next slide, I would like to show you an example of a poster that was produced in a country office of TDH, explaining, okay, this is the issues that you might face. You might face also others. This is the channels that you can use to reach us. And then finally, this is how you can expect. We will try to solve the problem. So this is very important to come with also information supports that are visuals, are entertaining for children, and to organize a workshop on this actually. And the last slide is this is a tool produced by another field office, and I'm sure that you may have also already that in place. It's like how the data is used and processed. Of course, it's dealt with safely. It should be stored in a place that is accessible only by the relevant people and a limited number of people, and then anonymized. And then you can process the data to show, for example, you see in the center is a bit small, but the number of or proportion of cases received by modality. So you can see that one of them is working more than the other. The trend in case received by categories. And the type of the characteristics of the people who submitted feedback or complaints by gender, age. So you know, for example, you can know here. Here we see it's fake data, by the way, but you could say that you could see that children are really not raising any feedback, so we might have to organize something else for them. So this is just an example. We wanted to take like 30 seconds to think during a moment, in a moment where, as a child, you wanted to share feedback or grievance and you could not do it. We will not share that in plenaries, just for you to reflect with yourself. 30 seconds. And then maybe if you want to share in the chat quickly, what are the specific barriers that children could face in your community? What are the main important barriers they may face if they want to share a feedback? And then if you found any strategy to overcome those barriers. So I see shyness. They don't know how to formulate correctly their mind. Fear, miss of trust, lack of confidence, trust issues, no safe spaces. And what about the strategies that you've managed that you would recommend to overcome those barriers? Yeah, power imbalance. That's children experience constantly or very regularly power imbalance. So they fear, sometimes they don't feel even legitimate to raise a feedback. The CFRM mechanisms set are not child-friendly. Accessibility, fear of ignorance, fear of ignorance, neglect, trust, lack of relation between family members. It's very fast. They may worry about punishment. So retaliation, fear of retaliation is a big problem if they speak up. And I see already like suggestions that we should create safe spaces, have programs to build their assertiveness. Very good. Organize child participatory activities to get them to engage and provide feedback. Increase staff capacity preparing and ready to be ready to deal with children. It's a very good recommendation. So yes, other strategies, child-friendly centers, professional engagement. And this is really, yeah, so considering all those barriers that this group may face, or the groups will face, or the types of obstacles, but yes, empower children through leadership roles. So there's really like using peer-to-peer strategies. So you see there is all this competency building and trust building process that is important, and give them like the sense of that they can and they should and it's important and they can safely report. So so there are many of you like reporting obstacles and challenges and good strategy also. So it's not just about putting a feedback box somewhere. It's much more comprehensive, establishing a CFRM, and it's working on trust, is working on the agency of people, also making sure, empower them to make sure that they feel legitimate and capable, also work on assertiveness, feel capable to articulate a feedback. Thank you. That's really, I will look at all your contribution afterwards because it was very fast. If we can continue, I just wanted to share what we are testing in TDH. We're testing a game. We produced a game in Burkina Faso. We wanted to see if, like, having workshops with children. This game was co-created by different groups of children, but having setting up an atmosphere where they have group dynamics, relax to address difficult questions. I'm sorry, I see that the question are in. If you can click again on the animation, yes. So so this is one of the solution that we tested, and of course those children, they are participating in a PSS, in an MHPSS program, so mental health and psychosocial program, sport for protection. So we are working with them also on their on sociability, feeling of security, and other competencies. So this is a complementary activity as part of this this project. Someone said, wrote something very important in the chat, is that it has to be integrated in activities to make sure it's not something that is on top of and separated and tick the box. Okay, I see that there are many questions in the. You will get the presentation, so you will have access to this material. I'd like to take a time to see if we can discuss the questions that we received live. So some questions are popping up in the chat, others in the Q&A. So one of them is looking at the dashboard, what is your advice on learning from reports beyond of case numbers and categories? So these very good questions. Actually, I didn't show it in this dashboard. There was a descriptive. So the meal manager added a descriptive. So also saying a word on what type of cases and how we were managing to give a response. So data is supportive because you can see the trends. It's very important and useful, but this data should be discussed with the relevant people during project reviews or even SMTs, giving more information confidentially, of course, on the type of issues that were raised. And during those project reviews or learning events, we should also consider the CFRM data as part of the reflection. And eventually we should also go back to the communities and have the same analysis when we do evaluation or learning events. So it's important to connect, to use this data as part of a broader learning and evaluation strategy, I would say. I don't know if Sukanta, you want to add anything, please.
It's fine. And in the chat, there is one more question asked by Mehdi, and he was saying that what if, I mean, there is someone, I mean, who shared that, say like, I mean, like he has some feedback or the opinion, and if it is informal, then what to do? So in this case, actually, in working in the community, I mean, so we experience different kind of conversations with participants. But if it is informal, in this case, actually, I mean, you don't have to add them in the logbook. Otherwise, like if you receive it through the formal channels, hotlines, feedback boxes, FGDs, or other activities, it's useful that so we really like add them in the logbook and also take action. But I mean, often, I mean, like it's simple that you have to like thank the person, like that. I mean, in some cases, like we don't have to do something; just say thanks, like to really appreciate the feedback. And there is one more question which is asked by, I think, Abdul, that he is saying that he's doing mail and he's from a statistical background, and he's curious what are the key indicators are commonly used to assess the impact and also responsiveness of CFRM systems. That's a great question. There are really some indicators under the AAP, the effect, I mean the uh, like accountability for the affected population, and also there are some indicators under the ECO. I mean, like there are also some like ECO indicators, like say for percentage of participants reported that like they feel safe, I mean, while giving their complaint and feedback, and as a percentage of feedback or addressed by the organization, and as a percentage of, say, children said that the feedback, the response they've received were appropriate and also as per the expectations. So there are some indicators and which are really available online, and so you can also like use those indicators. Yeah,
Would be good if you could find a reference and then post it on the chat.
yeah.
And in TDH, we use a set of simple indicators. You can have the number of cases by category, then the timing for closing cases, for resolving cases. We have the fixed rate index, so the successful, the proportion of cases that are closed, they were successfully closed, and then the satisfaction by people on how their feedback was handled. Then others, as Sukanta mentioned, the feeling of safety, it's very important. We are not measuring it systematically still across TDH yet, but we will certainly. Looking at other questions. Sometimes participants, it's a question by Mehdi Hassan. Sometimes participants just provide a feedback opinion, like the session or meeting was good. Thank you. This was helpful for me. It was great. For this type of case, how can we process them? So yes, you have some organization that and we also have like the expression of gratitude. So this is also an information. It's a type of information feedback. We classify it under a specific category. So it's important also to acknowledge the expression of gratitude. So I hope I answer the question. Maybe the question is more complex than that. So please, Mehdi, Hassan, tell me if it was answered.
I think, Sophie, there is one question by Richard, and I think asked about kindly elaborate on the recording of the complaint and feedback, and whether the sensitive complaint or feedback are recorded using same recording methods, considering sensitivity of some of the complaints.
Yes. In our organization, sensitive complaints are not dealt by the team. They should not investigate by themselves. They should immediately report the sensitive complaint or an alleged violation of the code of conduct to a specific dedicated department we have in headquarters. It is called Ethic and Compliance. And ethic and compliance will take care of the investigation. So it means that the cases will not be recorded in the same database at country office level. They will just know how many cases might have been received, but there is no other information being registered locally.
Yeah. Yeah.
There is a question, so I'm reading it. I haven't thought about the answer yet, but I'm reading it loudly. So to ensure inclusive access, especially for non-literate or digitally marginalized communities, do you think investing in a toll-free hotline is relevant feedback channel? What criteria should guide such a decision?
Yeah.
I see you're smiling, Suganda. Would you like to answer this?
Yeah, so I think it's an excellent question, because I mean, we often work with the communities that are really vulnerable and have little access to those, resources, the mobile phones, or they can't read or write or something. So in these cases, it's useful to go to them and really talk to them. What the preferred methods they would like to choose for us. Yeah. So in those cases, it's really helpful to select the proactive methods like FGD or co-triad meeting, like discuss with them, go to, go to them and talk to them. It's the regular kind of, activities like that. But in many cases, like if they don't have access to mobile phones, or maybe, the hotline numbers, it's just really difficult to engage them in this process. As Sophie said, it's really useful to combine methods, right? Like you can also use FGDs and also use hotlines. So those have access to the hotlines, they can do it. But those, who don't have the, like access to phones or something, they can really so also share their feedback. So the answer is, it's useful to choose a mixed methods in this process. Yeah.
Mm-hmm. Thank you. And there is a question from Raj, who's working for TDH in Bangladesh. So it's a question regarding the CFRM report sharing methods for partners organization, as they have the organization SOP, which might not be similar with the TDH SOP categories and logbook. How can we document and visualize anonymously with our logbook?
Yeah, I think it's a process, and in TDH, we don't want our partners to replace their methods so with our process. I mean, they can maintain their process, and it's I think what is useful here to discuss with the partners, what is there in the process and what is our process, and also to see and discuss, are there anything that we exchange and share something to co-learn, and also that logbook and we have, and the forms that we have, it's not that we want our partners to actually replace that, but if they think that our tools and processes are really helpful to track the feedback and also help to monitor the feedback, for instance, of course they can adopt that. But at the same time, I think I mean uh, that we should also keep in mind that the partners also work with many other organizations. So in this case, it's really impossible for them to adapt their mechanism as for different NGOs, right? In this case, they have to really, so it's useful to come up with a decision and to really establish one mechanism that is the best fit for the, I mean, say for the organization. Yeah.
Yeah, very important that we wouldn't like to impose our tools on partners, and it would be even better to receive the analysis done by the partner and then see how we can also learn from that. There is a question on a database structure. What database structure or tools are recommended for securely storing and categorizing feedback data? Any digital new software available on the market? A sample Excel sheet is okay. We may share with, if you contact colleagues from TTH, we may share the Excel we are using. We are using Excel, so that's the part of the response. Yeah. Yes, there are softwares and specialized software to do that. We use a specialized software to process the sensitive cases, for example. I wish we could invest in this type of software for the CFRM feedback, CFRM data, processing the CFRM cases too. Hopefully we will invest soon. I know that some organizations are using ComCare to process the data, and it's very safe because it's a software that we use for regular case management and child protection also. But the cost is there. So if your organization is ready to invest, then they are, and it's good to be able to manage very safely this data because it's sensitive. It's a good question.
So maybe
yes, Kata.
Maybe one more question, and then and then I can stop maybe because it's over 30 minutes now.
Yes.
Yeah. So maybe this is the last question. How often should feedback be collected from the communities in situations where phones are only accessible to a few people, and the best way is face to face? So there is no easy answer to that question actually. So the best option is to go frequently, use different methods in the project areas to collect feedback, and to embed the CFRM through embed the CFRM mechanism in your activities, so that after the activities you take some time and also take the feedback of the participants. And say for instance, and it's also possible to take feedback on the activities and the processes and also interventions in the surveys, and also the evaluations that we do at the as baseline, as midline, and also in the end line. So there are many ways to go to participants and also ask for their feedback. So I mean our advice would be to choose a mixed method and also go frequently, and don't forget that it's really helpful for us to be accountable. Yeah, and also really helpful to adapt our program and also learn. Yeah. So what do you, Nico, now?
Yes, then I think if you don't want to address any more questions, then we should wrap it up here. I want to apologize again for the poll not working at the beginning. This is technology. I will launch a poll now. It's a really short poll, and this is going to work. It's only two questions, and this poll will help us, design better webinars. In the meantime, please check out the e-learning section of Local Link Hub, where you can find the free e-learnings about a lot of topics, like I said, institutional fundraising, communication, and of course the CFRM e-learning. We have a new e-learning. It's a financial foundation for national NGOs. It was put on last Friday. At this e-learning, we cover everything from donor audits to financial reporting to budgeting, risk management, and the use of Saga accounting. So please tell your financial colleagues that we have this e-learning as well. And we also put together a partner onboarding package. We put together all the essential e-learnings that are for our new partners, for sure. But if you are interested, you can also check this out, this package. We have a lot of participants filled in the poll, but I'm still waiting a bit for you to fill the poll, this end poll. I also shared with you the links to our social media channels. If you would require a certificate of attendance of this webinar, so please write us on the website. You can find our email address, but also at my personal email. It's Enikő. I will put it in the chat. Sorry, here. It's Enikő moment@edh.org. So you can write at this email if you would need a certificate of attendance for this webinar. Okay. I do see you did answered your so the certificate, it's a question. You can write me an email at enikő.vas. Here also I write you again here my email. Sorry, edh.org. So write at this email and I can send you a certificate. Please allow a bit of a time to elaborate these certificates for sure. Okay, I do see that a lot of people already filled in the end of poll, the poll at the end. So thank you for your help, for being here at this webinar, and see you at our next event. Thank you. Bye-bye.